Hi everyone, welcome back to Nico the Vet on the YouTube channel. The forum, of course, where what I'm trying to do is discuss common veterinary medical issues to just act as a bit of a reference source for people who are sort of wondering a little bit if they could have a just like informal sort of discussion about what's going on with their pet. So today I thought the subject should be diabetes, and we'll focus a little bit probably more on cats than on dogs, but really the idea is applicable to both. So first of all, what is diabetes? To be a little bit pedantic, you get two types of diabetes. You get diabetes mellitus and diabetes insipidus. What's the difference? Diabetes mellitus is the one we're all more familiar with. A colloquial term would be sugar diabetes, because what in effect is happening is you have too high a blood sugar level, and that spills over into your wee, so you have a lot of sugar in your wee too. As opposed to diabetes insipidus, which is similarly named but a completely different mechanism. It has nothing to do with blood sugar levels at all. It's got to do with the deficiency of the hormones which regulate your water retention, and that's what makes you wee a lot more. So in medieval times, the differentiation between diabetes, anything that made you wee more, they were just called diabetes, and then mellitus was the sweet one, insipidus was the tasteless one. So if you think about the word insipidus means sort of to have no character or no taste to it, and that's because in the medieval times, if you were weeing a lot and drinking a lot, you would take your wee to the doctor, they'd stick their finger in the wee, have a taste. If it was sweet, you had diabetes mellitus, sugar diabetes, and if it was tasteless or insipid, then you had diabetes insipidus. So there's a gross diversion, but it just helps you to remember. So looking at diabetes, I'm going to talk about diabetes when I mean diabetes mellitus. So just for the sake of simplicity, I'll just say diabetes. So diabetes in human beings, if we think about it, you get type 1 and type 2 diabetes. In very simplistic terms, type 1 diabetes means you are just not making insulin, so you have to inject yourself with insulin to get it that way. Whereas type 2 diabetes, you are actually making insulin, but there are issues in your body, like you're overweight or you're not exercising enough, that are interfering with the ability of the diabetes of the insulin to do its job. So type 1 diabetes, you're not making it. Type 2, there's some interference. So in animals, all the diabetes that we deal with is type 1 diabetes. So what's salient about that is if you've got type 1 diabetes, you need insulin because you are not making enough insulin, so you need insulin from somewhere. In real terms, that's going to be injectable insulin. So it's a bit of a shock horror when people come to me. We diagnose diabetes mellitus, and I say, right, you're going to have to jab this cat or this dog pretty much for the end of for their entire lives. There's a little bit of exception with cats. Cats can sometimes become diabetic for a while, and then they can become undiabetic again. So you're not necessarily committed for life. Assume you are, but you may be let off the hook, and a little bit more about that later. So what's the problem in diabetes in cats and dogs? Think of diabetes as a problem with the production of insulin. Where is it produced? It's produced in the pancreas. What's the pancreas? The pancreas is a gland which lies along your stomach and the first portion of your small intestine, and it has two jobs. Job number one is to make digestive enzymes, which it pumps out through a little tube that goes into your intestines and helps you digest your food. So that's sort of the exocrine function of the pancreas. And the second function of the pancreas is it has cells in it called the islets of Langerhans, and those cells make the insulin that we need to regulate our blood sugar levels. So when you are an animal and you've got diabetes, there's a problem in your pancreas with the net effect that you are no longer producing insulin. So what does insulin do? How does it function? Think of an analogy, if you like. Think about a boiler man whose job it is to stoke a boiler, keep the fires going, keep them burning. And what does he stoke it with? He stokes it with logs that come past him on a conveyor belt. So the boiler man effectively is taking the logs off the conveyor belt and putting them into the boiler. So in veterinary terms, the boiler man is the insulin. Think of the conveyor belt as your blood supply. Think of the logs as the glucose, so the blood sugar, and he's taking the glucose out of the blood supply, so off the conveyor belt, and he's putting it into the boiler, which are the cells, which then burn it up and use it for energy. So insulin is the man, the boiler man, and his job is to move glucose from the blood vessels into the cells. So when this doesn't happen because you're not making enough insulin, so you no longer have a boiler man, so that's out of the equation. So you've got your cells on this side, which is the boiler, calling out for fuel. You've got your conveyor belt, which is the blood vessels carrying the insulin, which are the logs on that side, but you don't have anything to deliver the logs into the boiler or the glucose into the cells. So the effect of that is, because you've got no one unloading it, is the blood sugar levels will be high because it's not being unloaded. Unfortunately, it's not being unloaded anywhere. So it's not being unloaded to the muscles, so you're going to feel weak, and it's not being unloaded to the brain, so you may have confusion initially, and if you continually and severely deprive the brain of glucose, you can have seizures and even death. So the body's response to this, if you're diabetic, is to say, well, I need to fuel the boiler, and if I can't get any logs off the conveyor belt, I need to find an alternative source of energy. And what the body will do in this situation is start mobilizing your fat reserves in your body, and it breaks the fats down into effectively ketones, which is just a name for a different fuel, and your body then uses the ketones to fuel itself. Now, some people will be familiar with ketones from the Atkins diet, which was popular several years ago. And effectively in the Atkins diet, what you're doing is you're eating protein only, you're eating no carbohydrates, no sugars, and that means you're giving your body very little sugar, and so you force your body into a crisis state where it goes, there's no sugar supply, I need to mobilize fats, and you know the Atkins diet is working when you get that peculiar taste in your mouth, and that's the taste of ketones. And it always made me smile that the diet was so popular, because for a diabetic patient, and certainly in general medical terms, if you've got ketones, which is the byproduct or the product of the breakdown of your fats, you're in trouble. That's a physiological problem, and you do not want to end up in that situation. Because if the ketones keep going up and up and up, your blood sugar level is going up, but it's not available to you. You can go into ketoacidosis, and you can go into a ketoacidotic crisis where you will go into a coma, you can seizure, and you will likely die if we don't help you. So an undesirable situation. So how do we diagnose diabetes? And the effect of having a high blood sugar level, so it's not being unloaded into your cells, is that it's very high and it's tipping over into your wee. So you're ending up with glucose tipping over from your blood into your wee, and as it does, it grabs water and it pulls water with it. How does it do that? Think about if you spill wine on the carpet and you want to quickly resurrect that problem, you would pour some salt on it. So the salt will sort of suck the wine out of the carpet and hold onto it. That's its action. It's hydrophilic, so it sucks water. Now the sugar will do the same. The sugar will also suck water, and that's why if it's spilling over into your wee, it carries water with it. And now not only do you have sugar in your wee, but you have a lot more wee because you're pulling a lot more water with it. So your obvious symptom is going to be, if you're making more wee, you need to wee more. And if you're weeing more, you need to replace the water that you've lost with the sugar by drinking more. So the typical feature is you drink more and you wee more. And in animals, often you'll see an increase in the appetite, and that's because although your blood sugar levels are very high, so the conveyor belt is just full of logs or sugar or glucose, it's not getting into the cells. So the cells are crying out for energy, and the message goes to the stomach and the brain saying, feed me, I'm hungry. So these animals will be often eating more and drinking more and peeing more, and those are usually the common prompts that make you come down the vets. To make the diagnosis at the vets, you can examine a diabetic patient all day, every day, and you will not make the diagnosis until you do a test, either on the blood or the wee. I like to do both just to double check that. And there are also many other causes which can make you drink more and wee more. So you want to rule those out at the same time. So although I say you would drink more, wee more, and you would eat more in the beginnings of it, as you become ill with it, so as you start to go into ketosis and ketoacidosis, you will lose your appetite, because now you've become ill, and you'll lose your appetite, but still you'd be drinking a lot and weeing a lot. And over time, because you're not getting enough glucose to the brain, you'll start staggering around. So the brain is not fueled, so the brain can't do its job, which is to control all your movements, and you look like a drunk. You'll sort of stagger around, you'll be wobbly and woozy and wobbly, and that's another giveaway that you may well have diabetes. So down the vets, get them to test it. Very easy, just take a blood sample, measure it straight away, yes or no. If the answer is yes and you are diabetic, The implications, like I said, are your pancreas is not making insulin, so you need insulin from somewhere else. And that somewhere else is going to come in the form of injectable insulin. There are many injectable insulins in human beings. You get ultra short acting, medium, long, ultra long acting. The veterinary market is very much more limited. We have very few insulin types to choose from, as a consequence, we don't have quite such tight control over the diabetes as you would in human beings. But that's also compounded by the fact that we have a patient that can't speak to us. So what I mean by that is, if you're a human being and you're diabetic, you can check your blood sugar levels all the time. You can assess sort of how you're feeling, and you check your levels. You go, oh, my sugar's a bit high, so I'm going to give myself a little bit of insulin for a top up. And then you go, oh, I'm feeling a bit run down. I've skipped lunch today. I'm a little bit low. Oh, I think I'll eat something high sugar and just boost it. So people who are treating their diabetes with a combination of their diet and the insulin are maintaining themselves in a really narrow band of sugar levels, the same band that your body would maintain you in if you were not diabetic. So if we accept that we're treating cats and dogs, so they can't talk to us, they can't tell us how they're feeling, we're never ever going to control them as well as you would a human being. If we accept that, it takes a lot of pressure off your shoulders, because you're not trying to achieve that same level of control. So much so that although when we treat them, we like to monitor what's happening with blood tests and wee tests, we also have to accept that if you did what's called a glucose curve, so you take your cat or your dog to the vet, they take a blood sample every hour, and they plot a graph on a curve to see what your sugar levels have done in the day and how that has been affected by the insulin you're having. That guides you a little bit as to, am I on the right insulin? Am I on the right dose of the insulin, and am I well controlled? The problem is, when you bring your cat or your dog to the vet, and we do that at the vet, what we've just measured is how well is this insulin working for you, the cat or the dog, while you're in a stressful environment at the veterinary clinic. So it's not necessarily a reflection of how well and how long you're being controlled by your insulin when you're at home. So that's the flaw in it. It assesses how well controlled you are in a stressful foreign environment, which is not really great. So everyone's become a bit more laid back about this. We have a way around that with technology. We can do a test called a fructosamine test, which is a retrospective test. So rather than looking at your blood sugar levels on the day, to oversimplify it, think about it as it gives you an average of how your blood sugar levels have been over the last 3 weeks. On average, if you average out every minute of every day on about 3 weeks. That's pretty handy, because you get that retrospective look, and you can make forward planning decisions and not be influenced by the stress that you would have doing a glucose curve on the day. But some people might even be more simplistic about it and say, well, hang on, once we've determined that we've given you the right insulin level, basically, as long as you've got a normal thirst, you're weeing a normal amount, you've got a normal appetite, and you're not losing weight, because that's another sign we would see in animals, because the sugar is not going from the blood supply into the cells aren't being fueled, and you will start to lose weight, partly because of that, but partly also because you're mobilizing fat. So if we're treating a patient and we see that all of those things are constant and steady and stable, you can surmise that you pretty much have this patient controlled. I wouldn't dismiss testing altogether, because we have to be sure that we are not over-treating you or under-treating you. So when we imagine that your glucose curve, when you wake up in the morning, that's the most stressful time for your body. So your blood sugar level is very high. We give you a shot of insulin, so your blood sugar level starts to drop in the course of the day. And then as the insulin wears off, your blood sugar level starts to go up again. And then we get you in the evening with another jab, and you go back down again. So you're doing sort of a sinus curve like this. And the idea behind that curve is ideally you want to keep yourself between about 3 and 9 on the curve. So you're doing that in between, but you're not going above that line or below that line. And you want to be there most of the time. And the testing will sometimes tell you whether you are in fact dipping below that line for certain times of the day, because your cat or dog may not be able to tell you that. All they'll feel is they'll feel really, really tired, a little bit wobbly, and they may just sleep it off during that time of the day until they have their next meal and we carry on with the insulin treatment. So you can sometimes be overdoing it without realizing that you're overdoing it. So again, the tests are helpful in determining that. So how do you know if you're overdoing it or you're underdoing it? Meaning, is your blood sugar level too high because you're not getting enough insulin, or you're getting too much insulin and your level is low? Well, first of all, which one is the more dangerous situation? It is much more dangerous if you're treating a diabetic in the veterinary world. The human world may be different. In the veterinary arena, it's much more dangerous to have given someone too much insulin, because the effect of that is it unloads all of the logs or all of the sugar off the conveyor belt out of the blood supply into the cells, which is great for the moment, but then there's nothing left. So there's nothing left in the blood supply. There's no sugar levels left. So your sugar levels are very, very low, and your brain is very hungry for glucose. And it's going, well, hang on, where's mine? If the rest of the body has had this big hit, and you've got nothing, and again, the brain can't work. So you'll be wobbly, staggery, you'll look like a drunkard, and fall over and eventually pass out, go into a coma, and you could die. Now, you will get the same symptoms if you're underdosing, so your sugar levels are too high, but again, they're not getting into your brain. So either way, the brain is being deprived. But the much more dangerous situation for the brain is too much insulin and the levels are too low. There's a much more significant deprivation on the brain. So if you have a diabetic cat or dog at home and they suddenly go weak and wobbly, assume the worst case scenario. Assume they've had too much insulin and give them some sugar to bring up their blood sugar levels. So you can do that with glucose powder or just honey or syrup and a big glob in the mouth. Step one. Step two, immediately phone the vet and say, I'm on my way. My diabetic cat or dog has gone wobbly, and they won't be able to tell you which way they've gone. It could be over, it could be under, they don't know. And just say, I'm coming to you now, and you'll get there, and they'll do a quick test, and you'll know immediately whether they've had too much insulin or too little insulin, and then we can rectify it. That will be dependent on a blood test. So as mentioned at the beginning, cats, however, may become diabetic, which means their pancreas is not producing insulin, so they're diabetic now, and you treat them, and oftentimes in as little as sort of on average maybe 4 to 8 weeks, they may suddenly become undiabetic, meaning they start making their own insulin again from the pancreas. And these cases can really catch us out because you have no inkling the cat's about to start making insulin. So you as always, you get up and you jab them with their insulin, so they've got insulin in their body, and that starts unloading the sugar from the blood supply or the conveyor belt, and then they make their own insulin. So now you've got too much insulin because I've given you some and you've made your own. So the effect is, like we discussed, you've completely unloaded the blood supply. You've chucked it all into the cells, which is all good and well for the moment. But then once the blood supplies are depleted, then you're going to get the weak wobbly brain thing going on. So that's no good. And usually they give you no inkling. The first thing you know is your cat's staggering around like a drunk. So you go to the vet and you diagnose it, and then these guys will often have become undiabetic because something has obviously happened previous to this, which has damaged the pancreas's ability to make the insulin, and this has then repaired itself. And some cats may dip in and out of diabetes. It's extremely frustrating that they're dipping in and out of it, but it's good in the sense that they may become undiabetic permanently. The best way to try put your cat in the recover permanently and no longer be diabetic is to diagnose the diabetes early in the onset and to treat it efficiently and control it very, very well. That gives you the best possible chance that you're going to control it. So feeding also plays a very big role. Again, think about the feeding as the fuel, so the logs coming into the system. So what you'd ideally want to do with a dog is feed them a half to 60% of their portion in the morning, of their food portion. Oh, my cat flees back again, complaining about being left out. So feed about 50 to 60% of your daily ration in the morning. So eat it all. So that goes into your stomach, gets absorbed into your blood supply. So you've now got sugar in your blood supply, or the equivalent of the logs on the conveyor belt. And then about half an hour later, have your insulin. So that's introducing the boiler man, who will start unloading it again. So, and then you do that again in the evening. You feed the remaining proportion of their diet, and then you wait half an hour, or within half an hour of the meal, you give them the insulin, which is the boiler man, and the whole system starts unloading. That's in a perfect world. Having said that, you don't have to live your life around this. You don't have to sort of change lifestyle, and if you're out and about having a good time, oh my word, it's time to go home and jab the cat or the dog. It's pretty flexible. I think if you go overdue by more than about 3 or 4 hours, then it's better to skip that dose and just carry on from when the next dose was due. Because remember, if you're late from your party and you've come home at 2 in the morning and you've been on the razzle and you give your cat the insulin they should have had earlier in the evening, and then tomorrow morning you get up and before you go to work you jab them again, they've just had 2 hits very close together. And remember, we said it's more dangerous to have had too much insulin than too little insulin. So if you're more than about 3 or 4 hours overdue, just skip it and carry on the next day. Feeding in cats, again, tricky. Because ideally you'd be doing the same thing. You'd be feeding the cat 2 meals a day like the dog, and you give them the insulin after. But cats don't live like that. Cats are grazers by and large, so they like to snack a lot during the day. And you would think that would mess it up because you're not putting in the fuel or the logs at the same time as you're introducing the boiler man. So you'd think, oh, this is just not going to work. But in reality, it actually works quite well, just to give the cat their food and let them graze. On that subject, what food to feed? What you're trying to avoid with the diabetic patients are your very high glucose, your high sugary, high grain foods. So ideally you want to bias these guys towards more high fiber. The idea behind the high fiber, it's just like you and me getting up in the morning, and you can either eat some high fiber like bran or Weetabix, which has a very slow release energy during the course of the day, and that means your body is constantly from your stomach and your digestive process, you're introducing glucose or the logs into the system, and the boiler man can sort of unload them during the course of the day. There's no massive surge. Whereas if you have a huge like waffles and pancakes, what you're doing is you're getting a big sugar spike in the morning. The boiler man or the insulin is frantically going to unload it, and then you get that sugar low later in the day. So if you're already trying to control your sugar levels artificially with injections rather than letting your body do its clever stuff and maintain it, that's not what you want. You don't want to put yourself into a high sugar, low sugar, high sugar, low sugar, and is there enough insulin that I've injected to deal with it? No, just don't go there. So you'd want to go on slow energy release foods. There's an endless debate about what is the best thing to feed a cat or a dog, but if we accept that we're not opposed to proprietary managed prepared commercial diets, my advice would be go for that one specifically. Get like a diabetic cat or dog diet, and effectively what it is, it's a high fiber, slow energy release food, and then couple that with the advice that we said about the insulin, and it really should be happy days. So normally when I tell people their cat's diabetic, they're absolutely horrified. I've never seen anyone even try and disguise the fact that they're horrified by the idea of injecting, but it's really not rocket science. If I can do it and your vet can do it, then you can do it absolutely fine. 2 little things to remember: if you are using the veterinary insulin, which you will do in most parts of the world, that's not interchangeable with human insulin. So whatever insulin you're on and it's working, that's your insulin. If it's not working, you can try something else. There's a secondary product called glargine, which is sort of similar to insulin. So if insulin has failed, you can often try that. But you have to use the product that your vet has given you, and you have to use those syringes. You can't nip down the pharmacist and buy cheaper syringes because they may not be appropriate for that strength of insulin. So as long as you follow the basic rules, like I said, the look of initial horror that everybody has is unfounded. It's not that hard to jab them. You'd think it would be painful, but the proper sort of insulin needles are extremely thin, and just with just 5-10 minutes practice with your vet, you'll find how easy it is, and you just got to get a feel for it. You can use insulin pens, which are like human pens, where you put a little cartridge of insulin in and you dial it to set how much you want, and then you just push a little trigger and you push the pen on you and bang, it gives you the dose. You can do it that way. I find that's more expensive than using needles and syringes and insulin conventionally. So if you're not absolutely appalled by the idea, or you don't have arthritis or some reason that's going to be difficult for you, then the needles and syringes are absolutely fine. As appalling as it may sound, even just saying needles and syringes, I can imagine my father's a bit squeamish. I can imagine his toes curling at the thought of it. But you'll very quickly get into it, and people are so in tune with their cats and dogs that they will very quickly get a sense of I'm not sure the insulin is too high or too low, and know when to seek veterinary advice. If you are very proactive, you could buy a blood glucose meter. That does mean another prick. I normally just prick the ear and get a drop of blood. no point really using the human glucometers, those little devices that measure your blood sugar levels. They're just not great in the veterinary world. They're not accurate. You get veterinary ones, they're not deathly expensive. So if you're very proactive, you could get one and prick your cat or your dog as many times or a few times a day as you'd like, just to inform yourself about where they are. Another way is monitor the urine. But again, you can make this as complicated or as simple as you want. I like to keep things simple, and to do that, like I said, the most simplistic way will just be monitor body weight, thirst levels, appetite levels, and quantity of wee. And if all of that's pretty normal and your cat's happy and active and alert, they're well controlled. And the same applies to your dog. So if you have been diagnosed, not you, if your cat or your dog have been diagnosed with diabetes, don't give up. Don't be defeatist. It's not a, oh my word, it's the end of the universe thing. Get over the initial, like, damn it, here's an extra task for me to do, and enter into it in the spirit of a sort of a can-do spirit, and you'll find it much easier than you think. So hopefully that makes some sort of sense. Just to remind everyone, this is the Nico the Vet channel. My aspiration is to try and give some sort of source of information and my opinion on things, and hopefully a sensible explanation of what's going on, just to help clarify things in people's minds. If there's any subjects you particularly want me to go into and discuss, just let me know on the nicothevet@gmail.com. Sadly, I can't discuss your individual cat or dog with you, but you can tell me what the issue is with them, and I can discuss that as a broad topic. Take it easy. We're in the middle of COVID times, so pretty grim time for everyone. We will get through this. It's just a matter of us all pulling together, banding together, and helping each other through it. So take care, everyone. Bye-bye.